Most doctors believed in the miasma theory, which claimed that diseases like cholera were caused by polluted air or bad air, also called night air. Snow strongly questioned this idea. He believed cholera was spreading through something people consumed, not the air they breathed. John Snow was an English physician and a leader in developing anesthesia and medical hygiene. He is widely regarded as the father of modern epidemiology and as an early advocate of germ theory. Snow was born in 1813 in York, England, the first of 9 children. His father worked as a laborer at a local coal yard and later became a farmer in a small village north of York. He grew up in one of the poorest neighborhoods of the city, often threatened by flooding from the nearby River Ouse. He experienced unsanitary conditions firsthand, with most streets dirty and the river contaminated by runoff from markets, cemeteries, and sewage. From a young age, Snow showed a talent for mathematics. At just 14, he began a medical apprenticeship. By 1832, while working as a surgeon-apothecary apprentice, he faced his first cholera epidemic in the coal mining village of Killingworth, gaining valuable experience by treating many victims during the outbreak. Alongside his early medical experiences, Snow also made important personal choices. He adopted teetotalism, the practice of abstaining from alcohol. He was a vegetarian and preferred drinking only distilled pure water. In 1832, Snow started working as an assistant to a colliery surgeon, helping with the medical care of coal miners, before enrolling at the Hunterian School of Medicine in London in 1836. By 1837, he had started working at Westminster Hospital. Over the following years, his medical career continued to grow. He qualified as a member of the Royal College of Surgeons in 1838, completed his medical degree at the University of London in 1844, and later joined the Royal College of Physicians in 1850. Around this time, he also helped establish the Epidemiological Society of London, which was formed after the devastating cholera outbreak of 1849. After earning his doctorate, Snow opened a medical practice on Frith Street in Soho, working both as a surgeon and a general practitioner. His interest went far beyond routine medicine. He was deeply involved in the study of anesthesia and actively participated in the Westminster Medical Society, a group focused on advancing medical knowledge through research and experimentation. Snow regularly presented his ideas at society meetings and published several scientific papers. One of his early works, on asphyxiation and on the resuscitation of stillborn children, examined how newborns breathe and how oxygen and body temperature affect survival, showing his growing interest in physiology and public health. Later in his career, Snow also explored hidden causes of disease. In 1857, he published a pamphlet linking poor quality bread to rickets, an early example of how everyday environmental factors could affect population health, an idea that would later become central to epidemiology. Snow also studied chloroform, which was introduced in 1847 by the Scottish doctor James Young Simpson. He quickly realized that chloroform was far more powerful than ether and required much greater care when being administered. This danger became clear after Hannah Greener, a 15-year-old patient, died during a minor procedure due to improper chloroform administration. Snow investigated her case and several others, concluding that chloroform had to be carefully controlled. He shared his findings publicly to guide other physicians. Snow was among the first doctors to calculate safe dosages for ether and chloroform, making surgery and childbirth far less painful for patients. He also designed special equipment, including inhalers and masks, to deliver these substances more safely. Despite his groundbreaking work, Snow never tried to patent his methods. Instead, he focused on research, observation, and sharing knowledge to improve medical care for everyone. Within a few years, Snow became the most respected anesthesia specialist in Britain. Surgeons across London regularly asked for his assistance. Despite his careful approach, the use of chloroform during childbirth was opposed by many physicians, and even the Church of England, who considered it unethical. This changed dramatically in 1853, when Queen Victoria asked John Snow to administer chloroform during the birth of her son, Leopold, and later during the birth of her daughter, Beatrice, in 1857. These events played a major role in making pain relief during childbirth widely accepted. At the time, most doctors believed in the miasma theory, which claimed that diseases like cholera were caused by polluted air or bad air, also called night air. Snow strongly questioned this idea. Although germ theory had not yet been developed, he believed cholera was spreading through something people consumed, not the air they breathed. Based on his observations, he rejected the idea that bad air was responsible. Snow first published his ideas on cholera transmission in his 1849 essay on the mode of communication of cholera. He later expanded this work after the 1854 cholera outbreak in London's Soho district, making his focus clear: the city's water supply. By speaking directly with local residents, Snow traced many of the cholera cases back to a single public water pump on Broad Street. Even though laboratory tests of the water did not clearly show contamination, the pattern of illness was striking. Most victims lived close to the pump or regularly drank water from it. Snow presented his findings to local officials, who agreed to remove the pump handle, preventing people from using the water. This decision is often credited with stopping the outbreak. To support his case, Snow created a map marking cholera deaths with dots, clearly showing a cluster around the Broad Street pump. Homes supplied with polluted water from one company had far higher death rates than those receiving cleaner water from another source. Later investigations revealed the true cause. The well was located just a few feet from a leaking cesspit contaminated with human waste. At the time, such cesspits were common beneath homes, making contamination almost unavoidable. Snow's work became a turning point in public health. His methods, collecting data, mapping disease, and linking illness to environmental causes, laid the foundation for modern epidemiology. While similar studies had been attempted earlier, Snow was the first to clearly demonstrate the connection between contaminated water and the spread of cholera. Despite this, many officials rejected his theory. John Snow passed away in 1858 in London at the age of 45. Today, the John Snow Society honors his work with the annual Pump Handle Lecture, symbolically removing and replacing a pump handle, a tribute to a man whose work continues to guide and inspire scientists and doctors worldwide.
Enjoying our content? Subscribe now to Few Minutes Knowledge and don't miss the next story.